Color blindness. About 3.7% of the American population is diagnosed with color blindness. Color blindness is a condition where the eyes have difficulty distinguishing certain colors, most commonly red, green, or blue. This happens because the cone cells in the retina, which are responsible for detecting color, don't function properly. A large portion of color blindness comes from the X chromosome, which is why men are affected far more often than women. If a mother is a carrier, her sons have a 50% chance of being colorblind, while her daughters have a 50% chance of becoming carriers. If the father is colorblind and the mother is normal, all daughters become carriers, and none of the sons are affected. Doctors usually diagnose color blindness using color-based tests such as the Ishihara test, which uses colored dot images to reveal numbers or patterns. In rare, severe cases, a person may see the world only in shades of gray, though this condition is extremely uncommon. Hemophilia. Hemophilia is a rare blood disorder that makes it hard for the body to form blood clots, which means bleeding lasts much longer than normal after an injury. This happens because the body lacks certain clotting factors, either factor 8, hemophilia A, or factor 9, hemophilia B. Hemophilia is passed down through the X chromosome, which is why most patients are male, while females are usually carriers. If a mother is a carrier, her sons have a 50% chance of being born with hemophilia, and her daughters have a 50% chance of becoming carriers. If the father has hemophilia and the mother is healthy, all daughters will be carriers, and all sons will be unaffected, because sons do not inherit the father's X chromosome. About 33,000 males in the United States currently live with hemophilia. Diagnosis is done through clotting factor tests, bleeding history evaluation, and genetic testing. People with severe hemophilia usually need lifelong clotting factor replacement therapy to prevent dangerous or internal bleeding. Huntington's disease. Huntington's disease has an autosomal dominant inheritance pattern, which means if one parent carries the mutated gene, the child has a 50% chance of inheriting it, regardless of gender. Almost everyone who gets this mutated gene will eventually develop the disease, even though symptoms usually don't show up until age 30 to 50. This condition is caused by a mutation in the HTT gene, which leads to progressive damage in nerve cells in the brain, especially in areas that control movement, emotions, and thinking. In the US, about 200,000 people are believed to be at risk of inheriting this mutated gene. Diagnosis is usually done through neurological exams, family history evaluation, and genetic testing to confirm the HTT mutation. Early symptoms may include behavioral changes, uncontrolled body movements, and difficulty speaking. Asthma. Asthma occurs due to inflammation and narrowing of the airways, especially the bronchi, which makes it difficult for air to move in and out of the lungs. The airways become sensitive and easily react to triggers such as allergens, cold air, pollution, or physical exertion. Its inheritance pattern is multifactorial, a mix of certain genes combined with environmental factors. For example, if one parent has asthma, a child has about a 20 to 30% chance of developing it. If both parents have asthma, the risk can rise to 60 to 70%. In 2022, about 26.8 million people in the US were living with asthma. Thalassemia. Thalassemia is a disease that affects red blood cells, making the body unable to produce hemoglobin properly. When hemoglobin doesn't work the way it should, red blood cells become weak, break easily, and eventually cause chronic anemia. This condition is inherited from parents who carry the thalassemia gene, also known as carriers. If both parents are carriers, the child has a 25% chance of being healthy, a 50% chance of becoming a carrier, and a 25% chance of being born with severe thalassemia. If only one parent is a carrier, the chances are 50% healthy and 50% carrier. Diagnosis can be done through a complete blood test, hemoglobin electrophoresis, and DNA testing. Mild thalassemia is usually detected around 6 to 24 months of age, while carriers are often only noticed during teenage years. Severe thalassemia requires lifelong blood transfusions. Type 1. Diabetes. Around 15% of the North American population lives with type 1 diabetes. This disease attacks the insulin-producing cells in the pancreas, making the body unable to control blood sugar levels properly. Because of the lack of insulin, patients can easily experience high blood sugar, frequent urination, and weight loss. If one parent has type 1 diabetes, the child has about a 3 to 8% chance of inheriting the tendency, and if both parents have it, the risk can increase to 20 to 30%. Interestingly, type 1 diabetes is not caused by eating too much sugar or having a bad diet. Like many people think, diagnosis can be done through blood sugar tests, pancreatic antibody tests, and C-peptide tests. Type 1 diabetes is usually detected during childhood or teenage years. Management includes regular insulin therapy, healthy eating, controlled exercise, and blood sugar monitoring, because for now, there is still no cure for type 1 diabetes. Sickle cell. Sickle cell disease begins with a tiny change in hemoglobin that causes red blood cells to bend into a crescent. Once they change shape, the cells become stiff and can easily get stuck in small blood vessels, triggering severe pain. About 1 in 365 American babies is born with SCD. This condition is inherited from parents who carry the sickle cell gene. If both parents are carriers, the child has a 25% chance of having sickle cell disease, a 50% chance of becoming a carrier, and 25% of being born healthy without the gene. If only one parent is a carrier, the child won't develop the disease but has a 50% chance of becoming a carrier. Doctors usually detect SCD through a specialized hemoglobin test, especially if a baby shows signs like swollen fingers or toes, pale skin, or unusual fatigue. Breast cancer. This disease attacks the breast tissue, especially the milk ducts and lobules. It happens when the cells in the breast grow out of control and form lumps that can spread to other organs. If one of the parents carries this risky gene mutation, the child has a 50% chance of inheriting it because the inheritance pattern is dominant. However, inheriting the gene doesn't mean someone will definitely get cancer. It only increases the risk significantly. Interestingly, men can also get breast cancer, with about 1 out of 100 reported cases. Diagnosis can be done through a physical exam, mammography, and breast ultrasound. Breast cancer is usually detected when symptoms appear, such as a painless lump in the breast, changes in skin shape or texture, or abnormal fluid coming out of the nipple. Essential hypertension. Essential hypertension happens when your blood pressure stays high for a long time without any clear medical cause. This condition usually develops because the blood vessels become stiffer over time, so the heart has to work harder to pump blood. Essential hypertension is polygenic, which means it only increases the risk, not a guaranteed outcome. If one parent has hypertension, the child has about a 25 to 30% chance of developing it. If both parents have hypertension, the risk can increase to 50% or even higher. Diagnosis is done by repeated blood pressure checks, along with blood and urine tests to rule out other possible causes. Fun fact, around 49% of adults in the United States have hypertension.